singing from the same songbook.
Third dose.
Third dose.
Booster.
Booster shot.
Booster.
Booster shots.
Come out and get it.
New South Wales, Victoria, South Australia and the ACT today slashing the wait time for third jabs down to 3 months, ahead of schedule.
Today's decision will enable over 3.5 million more people from our state to be eligible for that booster shot.
This weekend we will have a booster blitz.
We have got plenty of supply. You can get an appointment today.
Boosters now more important than ever as a potential ticking time bomb looms.
When schools go back, an increase in cases would be expected. But we as a community can take other actions to offset that.
One of those actions is school surveillance testing, with plans for twice-weekly RATs set to be discussed at tomorrow's National Cabinet meeting.
There is a very strong case about surveillance testing with teachers. There is mixed medical advice on this when it comes to surveillance testing of students. Each state jurisdiction is going to make their own call on that.
Also up for discussion, the strained state of our health system.
What do you want? Safe staffing! Now!
Despite the frustrations and the very genuine concerns, we are proving resilient. Our health system, despite a lot of pressure, is holding up.
With the furloughing of health workers here in New South Wales, that's put extra pressure on the system, but there are also reassuring signs. And the heroes on the front line are our health workers, and they've been inspirational.
Those words cold comfort for healthcare workers on the brink.
We're not okay, and we're being told just to get on with it. Come in, do your best. You're tough, well done.
The 32 who died overnight, the 36 before that could have been avoided. These numbers were not inevitable.
We don't want thank you. We need safe staffing, or we need other ways to help this hospital system keep our patients safe.
Well, Dr. Norman Swan is co-host of the ABC's Coronacast, and he joins us now. Norman, we just saw one exhausted healthcare worker there saying some of the COVID deaths we're seeing now could have been avoided. Do you agree with that?
100%. We've just been too slow on this. In New South Wales, they lifted the restrictions when they knew that Omicron was around with a let-it-rip policy. And supported by the federal government. What was needed at that time was just to slow things down. I think I was on the project before Omicron came along talking about boosters and how boosters were required urgently for Delta. And we had a lackadaisical approach for boosters. What we had to do in December was slow things down so that people could get their third shots, which we've known for months they need, even with Delta. And a lot of the people dying have not had their booster. It's tragic.
Well, do you think today's announcement bringing forward that eligibility for boosters will help prevent more deaths?
Yes, it will. The booster shot just brings that immunity back. The most vulnerable people are the people aged over 60. They're the people who had AstraZeneca. With AstraZeneca and Omicron, there's almost no protection against infection and significantly reduced, about half the protection against severe disease. So the very people who are most vulnerable got the vaccine, which has got the least protection against severe disease. That's why we've got to amp it up. And there's this myth that this is a mild virus. You hear it all the time from politicians. It is not a mild virus. They compare it to Delta. Now, Delta was a virulent virus, and yes, it's less virulent than Delta. But if you compare it to the Wuhan virus, the very first one, it's just as virulent as that, if not more virulent. And look at the devastation that caused. That's why we're seeing deaths.
Norman, I know you're saying that, but the Prime Minister seems to be saying something very different. He's saying Omicron is, in fact, less severe. He's saying that the healthcare system is holding up. I mean, what do you say in response to basically just having completely opposing views?
Well, vaccination is what's protecting a large part of the community and making this a mild disease in people who are well vaccinated. So that's the case. And in other people who are not vaccinated, it's less severe than Delta, but it's not a mild virus. Greg Hunt admitted that the other day on Radio National. It's not a mild virus.
There's been a lot of talk about it transitioning from pandemic to more of your seasonal flu. You've called BS on that. Is that not what's going to happen?
That's the other thing. The politicians think this is all over Red Rover when Omicron flashes through. Two things about Omicron. One is a natural infection with Omicron does not seem to provide anything like the protection that an immunisation gives, unlikely to protect against the next variant. And they use this word endemic as if it's happy days when it goes endemic. All endemic means is that an infection is somewhere in the world circulating and never disappears. Smallpox was endemic. Nobody says that's a mild disease. Malaria is endemic in many countries. Influenza is endemic and it's not a harmless disease. Endemic does not mean harmless. And some people believe it's not going to become endemic at all because this is an epidemic virus. So it's not, I'm sorry to say, it's not all over Red Rover, and we've got to learn lessons. And letting it rip has caused economic damage and unnecessary deaths.
Just before we let you go, Norman, what do we do about school going back? There's talk of twice-weekly testing. I'm not sure where those rapid tests are coming from to do that across the country. But what would your approach be with school going back?
I think this is a very difficult issue, and some of it's political. Rapid antigen tests are not as accurate as you'd like them to be. There are variations between them. And I think the important thing is that any kid over 5 is immunised. They need to think very hard about shortening the interval from 8 weeks down to 3 or 4 weeks, which ATAGI has allowed in outbreak situations, really to give kids the maximum protection. I'm just not sure whether surveillance is going to give them the accuracy of infection they're looking for.
OK.
Dr. Norman Swan, we always appreciate your straight talk. Thanks for your time this evening.
Your pleasure. My pleasure.